Hi guys, today I'm going to teach you the topic aldosterone escape. So before going into the depth of the aldosterone escape, we need to know what is aldosterone, where it comes from, and what is its mechanism of action. So aldosterone is basically a hormone which is produced by the adrenal gland sitting on top of the kidney, right? So I make this adrenal gland over here. This is your kidney. This is your ureter. Then I make this diagram so you can simply know what are the structures you see over here. This is like a, you can say this part they magnify over here. Okay, so this is your peritubular capillaries, which are causes reabsorption of things from the nephron or the lumen into the blood. Then the next, these brown things, these are your endothelial cells, which are showing over here. And then next to endothelial cells is your tubular lumen, uh, where your urine is moving, right? Our urine is producing. Okay. Now we need to understand what is the mechanism of action of aldosterone. So aldosterone basically do what? So aldosterone, when it is secreted by the adrenal gland under the influence of angiotensin 2 or in case of adenoma whatsoever, what it causes, it do three jobs. So one thing, it causes activation of this channel, which is sodium potassium ATPase. By this channel, it reabsorbs 3 sodium and throwing 2 potassium out, right? It's throwing 2 potassium out and reabsorb 3 sodium out, right? Secondly, it causes activation of this pump, which is ENaC. So through ENaC, which is epithelial sodium channel, sodium will be moved inside the endothelial cells from the lumen. When sodium is moving inside the endothelial cell, the new inside towards the lumen side, you are creating negative charge. Why? Because sodium is positive charge. When sodium moves from the lumen over here, then what is happening inside the lumen? You're getting a negative charge. To balance that negative charge, your potassium will be moved out through this channel, which is called renal outer medullary potassium channels. So potassium will be go out. The third thing your aldosterone will be doing, this will causes activation of this pump, which is called hydrogen potassium ATPase pump. Through this pump, hydrogen is excreted out from the nephron or endothelial cells towards the tubular lumen. And these movement of potassium and hydrogen towards the lumen is under the influence of negative charge, which is produced by the influx of sodium into the endothelial cells, right? So this is simply the job of endothelial cell, right? Sorry, this is the job of aldosterone. Then, so what we understand from this, one thing you have to remember, that water will be go wherever your sodium is go. Okay. So over here, let's say this is your endothelial cells. Here the aldosterone comes. So aldosterone causes absorption of, sorry, I'm making just into the blood so you do understand. So, so aldosterone causes sodium reabsorb over here into the blood. 3 sodium reabsorb into the blood and it throw potassium out into the endothelial cells, and then this potassium is throwing out into the lumen through the this ROMK channels, right? And sodium is also coming inside these endothelial cells, and then it is again reabsorbed into the blood. So simply you have to understand that aldosterone do two jobs. It increase sodium reabsorption along with the water, right? And secondly, it causes increased potassium excretion and hydrogen excretion. So reabsorbs sodium into the blood along with water, and excretion, which is excretion of the hydrogen and potassium from the blood into the tubular lumen, right? So what will be the net action? Sodium is reabsorbed along with the water. That will lead to what? That will maintain your blood pressure, right? So this is the normal case. Now what is happening in aldosterone escape, right? Aldosterone escape is basically what it is, the pathogenesis of basically primary hyperaldosteronism, right? Okay, as I told you that whenever you have increased aldosterone, you increase sodium along with water reabsorption, right? And you also increase potassium and hydrogen excretion, right? So in case of primary hyperaldosteronism, why it is happening? Due to binodular hyperplasia of the adrenal gland or your adrenal adenoma, which is hyperfunctioning. So what happened? You have increased aldosterone, you can see over here. And what it does, it causes increased sodium reabsorption along with the water, so lead to increased blood volume. Also, it decrease potassium reabsorption. You can say this way, or you can say it causes increased potassium excretion, right? If they asking about what is the serum level of potassium, it would be decreased, right? So here they are saying decreased reabsorption of the potassium mean in the blood you are producing hypokalemia. Then if it throw the potassium ion out, this is your proton which is responsible for the acidic environment. So behind in your body, you are producing the metabolic alkalosis. So over here, just I want to mention one point which is shown over in the previous slide. So whenever you excrete the hydrogen over here through this pump, this water and carbon dioxide bind together under the influence of carbonic anhydrase enzyme and to form carbonic acid, which is then dissociate into the hydrogen and bicarbonate. So every hydrogen moving out, you are reabsorbing the bicarbonate into the blood. So that is why in this slide they are showing that it produces metabolic alkalosis, because for every hydrogen it throw out into the lumen, it reabsorb the bicarbonate ion, right? So what is happening overall? You have this picture: hypokalemia, metabolic alkalosis, and hypertension, which is increased blood volume, right? So in that case, whenever you have increased aldosterone, your renin will be decreased and your angiotensin too will be decreased. It is because of the negative feedback inhibit of this aldosterone. So aldosterone causes inhibition of renin and angiotensin too. So their level in the blood will be go down. So what is happening when you have excessive, because this is adenoma, right? And this means hyperaldosteronism, that it is beyond normal level of aldosterone in your blood. So this will lead to the increased blood volume, right? Increased blood volume into your vessels. So when blood volume into your vessels will be increased, so what will be happen? Increase blood flow go to your kidney, right? Also, so kidney will have increased renal blood flow, right? So that's they are saying. So increased renal blood flow, increased glomerular filtration rate because of the increased hydrostatic pressure in the glomeruli, and this will lead to the increased atrial neuritic peptide. So this atrial neuritic peptide, this is coming from your heart. So inside the heart, what is happening? So inside the heart, so let me draw heart over here. So inside the heart, you have this atrial peptide or beta neuritic peptide, right? So they are secreted when you have increased blood volume and increased pressure on the these walls of the heart. So heart will be released this neuritic peptide, and this hormone is responsible for the natriuresis, right? Natriuresis means it wash out sodium and along with the water. So what is happening? Sodium is excreted out of the kidney along with the water. So that is called aldosterone escape. That is when you have increased level of aldosterone, you have increased blood volume. Increased blood volume produces increased pressure in the heart. So increased pressure in the heart walls lead to the release of ANP, and ANP is basically causing natriuresis. So that why the overall picture they will ask you that in case of aldosterone escape, you have in decrease serum potassium, decrease hydrogen, or they can ask about the bicarbonate. You can say the bicarbonate will be increased, but they ask about the sodium. Okay? Sodium. If they ask about the sodium, so you will say it's normal, right? In case of aldosterone escape. Why normal? I told over here that the aldosterone increase the blood volume, increase pressure on the heart, and on the walls of the heart, they release the ANP. And ANP basically causes natriuresis, which maintain the sodium level back to normal. And that is what we call aldosterone escape. Like body is escaping from the effect of high aldosterone in the blood, right? Hope so you understand this topic today. Thank you so much. Stay tuned with me. I will come with another topic. Thank you. Bye bye.